Hello, this is News at 6 on Uhasbasetv. I'm Christiana.
And I'm Bernadette. Our main headlines. As Ghana begins inoculating its population, we asked when students will be vaccinated.
So I was quite shocked when I heard Ghana was the first country to receive the COVAX.
The Vice Chancellor of the University of Ghana publicly received his jab of the COVID-19 vaccine.
The Supreme Court of Ghana dismisses the election petition on grounds of no merit.
We have therefore no reason to order a rerun as proved by the petitioner as in relief F. We accordingly dismiss the petition as having no merit.
To our first story, Ghana has begun inoculating its citizens this week with the 600,000 doses of the Oxford AstraZeneca vaccine as part of efforts to reduce the devastation caused by the COVID-19 pandemic.
The vaccination rollout began in the Greater Accra region and Central region. The first group being vaccinated is those at high risk and with underlying health conditions. Ghana has now vaccinated more than 3,000 people with the COVID-19 vaccine. In the last update from the Ghana Health Service, there are 5,206 active cases with 602 deaths. In the Volta region, there are 303 active cases, the third highest in the country. The Vice Chancellor of the University of Ghana, together with his wife, have publicly received the COVID-19 vaccine.
But what about students? When will they receive their jabs? Would they take that vaccine? Some students spoke to Uhasbasetv.
Right. So as to whether I'll take the vaccine or not, right now trust levels are very low. So I'm not sure how I'll be taking the vaccine until any further development comes up.
Why? Because the main reason why, people are saying that it has not been tested, there has not been so many clinical trials and stuff. But one main reason why I would take it is that our leaders are taking it. Our leaders have taken the step to take it first.
Yeah, I would say yes, I would take it. Because I think the vaccine has undergone a lot of clinical trials, and because it's an emergency use, I think it is safe for use now. And moreover, it has been approved by FDA, and FDA is one of the good agencies that we trust for agreeing to most of the drugs we take in Ghana here.
The government of Ghana is proposing to make COVID-19 vaccine compulsory throughout the country if people don't take the vaccine. Some students expressed concerns to Uhasbasetv.
If it becomes so compulsory that we have to be placed on gunpoint to take the vaccine, then we don't have much to do about it. But if it's compulsory but not compulsory, if you get what I mean, then I'm not going to take the vaccine.
Partly, I don't agree with them, but partly I agree with them. Okay, the side where I agree with them is that making it compulsory is good in a way, because when some people decide not to take, they put others at risk. Yes, and then the part that is not good is that when you are making it compulsory for people to take, it's like you are acting against their will. Medically, it's wrong to force somebody to take a vaccine.
For making it compulsory, I don't think it will really help, because not everyone, no matter what you do, not everyone will take it. So you making it compulsory, it's like you are forcing people to take the vaccine.
Mr. Jerry Quay is a biochemist and also a lecturer at the School of Basic and Biomedical Science. He spoke to our correspondent on how the vaccines are made.
We have an inactivated virus, which is injected into an individual. So what happens is that this part of the virus or the pathogen stimulates the immune system of the individual so that antibodies are produced. And what that means is that should the actual virus or the pathogen that causes the disease enter into an individual, or if that individual is exposed to that disease-causing organism, it means that there's a memory that has been generated.
The full interview will be aired on Uhasbasetv on Sunday. Don't forget to subscribe.
Meanwhile, Johnson & Johnson says vaccines for children under 18 could be available by September. The company's CEO Alex Gorsky said that the FDA is already working with companies to establish the clear regulatory guidelines so that the appropriate data can be collected.
Last week, Johnson & Johnson first announced their first plans to study the vaccine in adolescents, saying it will begin testing in people between 12 and 18. Also, both Pfizer and Moderna are currently trialing their mRNA-based COVID-19 vaccines in children.
So UHAS SRC now. Parliament is set to have its second sitting for the semester. This sitting, which will see the approval of some committee chairs and the Electoral Commission, is scheduled for the 6th of March 2021 at 9 a.m.
In a letter signed by the Clerk of Parliament, the agenda for the meeting is set up the Electoral Committee approve budgets and make preparations towards the Miss UHAS 2021. Let's cross over to Parliament now. Hello, can you hear me? If you can, what can you report from Parliament for us?
So I'm here at the Parliament House of UHAS SRC. I can see a lot of activity going on here. There's going to be parliamentary meeting tomorrow. So I have here some few executives who I will be talking with. Right, so I have here the welfare chair of the UHAS SRC with me. Let's find out from here what's going to happen tomorrow in Parliament.
Okay, so as earlier communicated by the clerk of the UHAS Parliament, we'll be having some agenda for tomorrow, which includes setting up of the electoral committee prior to the upcoming elections, and also we have a presentation of reports from some of the committees, and then there will be a discussion on budget centralization as to what will be included in the central budget. And also, I think we'll be having discussion on the upcoming Miss UHAS pageantry as well. So those are some of the few agenda for tomorrow's parliamentary sitting.
Okay, thank you very much.
Thank you too.
Still in UHAS, India's High Commissioner to Ghana, His Excellency Sangan Rajaram, during a visit to the Institute of Traditional and Alternate Medicine, mentioned that there is a high probability of the Institute and India collaborating in traditional and alternate medicine.
The collaboration would include students and faculty exchange, collaborations and research. He mentioned that traditional and alternate medicine can facilitate the quest in meeting the healthcare needs of a wider populace.
The Vice-Chancellor of the University of Health and Allied Sciences affirmed the collaboration by saying, in the spirit of the university to train health professionals in the country and beyond, UHAS is open for available collaborations with external partners.
To other stories now, the Supreme Court has dismissed petitions challenging the 2020 presidential election results.
In delivering the judgment, Chief Justice Anim Yabua said the petition is dismissed without merit. He noted that the impact of alleged votes pardon, even if proved, would be very insignificant to overturn the results obtained by President Akufo-Addo.
In a unanimous decision by the 7 justices of the Supreme Court, he emphasized that the petitioner did not demonstrate in any how the alleged errors in the unilateral corrections by Jane Mensah affected the validity of the declarations made by her on December 9, 2020.
The Supreme Court judgment addresses 5 issues that were set forth for determination, including the question of whether or not President Akufo-Addo met the constitutional threshold for election to the office of president.
Former President John Mahama, who recontested the election on the ticket of the National Democratic Congress, took the Electoral Commission to court, challenging the validity of the Commission's 9th December 2020 declaration of Nana Addo Dankwa Akufo-Addo as winner of the polls.
This judgment by emphasizing that the petitioner did not demonstrate in any way how the alleged errors and unilateral corrections made by the first respondent affected the validity of the declaration made by the chairperson of the first respondent on the 9th December 2020, as already stated in this judgment. The petitioner has not produced any evidence to rebut the presumption created by the publication of CI 135, for which his action must fail. We have therefore no reason to order a rerun as prayed by the petitioner as in relief F. We accordingly dismiss the petition as having no merit.
Okay, so what do you think about the vaccination and the reactions people are giving? What's your idea? And would you take one yourself?
I would take.
Okay, that would be great.
But personally, I'm afraid of needles and injection.
Wow.
Yes, it will take time, but then I will just endure, tolerate, and then take.
Okay.
Yes.
And what do you think about the reactions people are giving?
Oh, it's normal. Inflicting pain on someone is not really so easy.
Yeah.
So it's good they react to
Okay.
it, but then the injection will still be put on.
All right, that would be great. So that's how we end today's edition of the News at 6. Download the UHAS mobile app on the App Store and Google Play Store.
Follow us on Facebook and Instagram at UHAS SRC.
Subscribe to Uhasbasetv. I'm Christiana.
And I'm Bernadette. Thanks for watching.